Well, hey, really fun time. You all both presented on the poster. So we've got Cristina Murphy and Tonya Phillips are here. Tell us about your poster. What did you all work on? What did you identify?
So we originally started our project on doing the trauma squad call report, and due to loss of our trauma program, we focused on stroke. We have a lot of new staff in our department. A lot are still in like the residency program as well. So we really focused on how well our staff is identifying symptoms of a stroke, whether it's through EMS report or through triage. We found that there was actually quite a bit of area of improvement, especially for the identification symptoms that are maybe not as obvious. And we did some education with staff at Huddle, through a poster, and other just as they're coming in, talking through the report. Afterwards, we went through and did our data, and we've had as much as 40% increase in our output. So
that's awesome. So stroke is so critical to identify quickly and timely, and to see a 40% increase is really remarkable.
Yeah, absolutely.
Tonya, how about you? Because you work in a leadership role in the ER a lot of times.
So we really focused on the calls that we got from the EMS and patients coming from triage in real time. And we just kind of did one-on-one education with the nurses as they would bring the patients back. And it really did make a big difference in in identifying patients with strokes and getting them treated in a timely manner.
Well, that's excellent. So I love how this project really was focused on real time making a difference in the lives of patients. So as you started this, you might have been a little bit intimidated to start a big PIAT performance improvement project. What advice would you give to somebody who's thinking about embarking upon their clinical ladder? What advice would you give them?
No, I think that the biggest thing is where you really want to focus on with us being a stroke center. We had the recent change of TPA to TNK, so we really felt that was a good area for our nurses. So,
well, excellent. Well, there you heard it. If you're thinking about it, if you're on the fence, talk to Tonya and Cristina. They are excellent resources. More importantly, they're making a difference in the lives of patients.